Joining us now is Ashley Cleveland. She's a registered nurse practicing in Tennessee. Hey, Ashley, and thanks for joining in today's conversation.
Hi, Josh. Thanks for having me.
Awesome, awesome. So, for our viewers who may not know you, can you just first start by telling us a little bit about your background?
So, I have been a registered nurse since 2016. I currently work in a medical ICU in Nashville, Tennessee. Before I worked in this ICU, I did a little bit of neonatal ICU and then a little bit of internal medicine, but I gravitated back to the adults. And I've been in the MICU for now 2 years, and it's been great.
Wow, that's amazing. Good background, good background. So, since you're currently a nurse in the ICU, can you just paint a picture of what you're seeing in your state for critical care nurses?
Pre-COVID, we always took one or two patients, and depending on if they were on had any type of like bacterial issues or like any type of contagious virus, they would be on contact precautions that we always would follow from the beginning. But now that COVID has moved in and wrecked all of our lives,
Mm-hmm.
basically, things have changed. And especially once they get up to the ICU, it's more so if they're confirmed, we're automatically going to wear all the stuff. But if they're suspected or what we call rule out COVID, we still wear all the stuff as if they were positive. So
Okay.
it's just a adjustment because it literally takes anywhere from 6 to 10 minutes to don all of the PPE. So
Wow.
like if a patient's crashing and you have to get in the room,
Yikes.
like you're losing those minutes just because it takes so long to get
Mm-hmm.
everything on. It's anywhere from like our gown, our gloves, and then at my hospital we use these devices developed by 3M called PAPRs instead of an N95 mask.
Hmm.
And they're great because your patients that can talk and aren't sedated and intubated, they can actually see your face and see you
Oh,
smiling.
wow.
So it's not like a
So it's
random person like
transparent.
all covered up. Yeah. So
Oh,
like they
wow.
actually can put a face with a name versus just my eyes. Um, but it's attached to a hose that we wear around our waist area, and it uses like pressure to keep pressure from coming in, and like when we exhale it keeps pressure
Mm.
from going out so that there's not any cross contamination. So those are really nifty and really cool, and I really like them because like I said, I'm actually able to smile at my patients because naturally I smile a lot. So having those N95 masks, I know it can be scary on the patient's end,
Yeah.
and then it's just makes it a little different, I guess, in a sense.
Wow, that's actually interesting. I'm more interested in the technology behind the transparent
Yes,
mask and the hose. It sounds pretty cool.
love them, love them, love them.
What is involved in caring for a patient when it comes to coronavirus? And I know you touched on what changed, but what is involved in regards to like visitors when people have relatives or family members? How has that changed pre-COVID and
Oh,
post-COVID?
drastically, drastically, drastically. So normally in our ICU, we would allow two visitors or like one visitor overnight and like two visitors at the bedside nonstop throughout the day until about 9 p.m. But now that this has rolled in, our hospital decided to do away with our visitor policy. And now we do not allow any visitors. There are some certain circumstances where some people are able to come in, but for the most part, I really like how our organization has moved to like a technology standpoint. So now we're using iPads and using like Zoom technology for family members and patients to actually, the ones that can talk, of course, be able to interact with their family members. So now we can't really have any outside visitors. As far as the care, like nothing's really changed. We're still taking care of the patients the same way we would. It just takes a lot more because we have to put all this stuff on. But the only difference is once you get into the rooms, I know like personally, I've spent anywhere from 1 to almost 2 hours in a room with a patient that was positive at one
Wow.
time, like throughout my shift. Because once you put all that on, you don't want to have to take it
Mm-hmm.
all off
And
and
go
come
to
back out,
another
come in
room.
and out. So we're trying
Yeah.
to cluster care as much as possible. But it's also a drawback, I think, from the patient's perspective because like we being nurses and working 12-hour shifts, we're constantly at the bedside, and we actually develop like a really good relationship with
Mm-hmm.
our patients and a really good rapport with their family members and things like that. But now that we're trying to minimize the amount of time that we spend in the room, we're trying to cluster everything together. I feel like it's lonely on the patient's end, and
Mm.
I see a lot of them like I had a patient a couple weeks ago. He was like, I'm just really sad because I'm sitting in here and like, my family can't be in here, and I know y'all are just doing y'all's job and y'all can't really stay in here with me, but it's getting hard to just be
Mm-hmm.
in this room. I can't come out of the room. Like y'all can't just sit in here with me, and it's
Yeah.
really difficult. So I can just only imagine like the type of
Right.
negative impact that this is having on like their emotional health.
Mm-hmm.
So it's kind of frustrating for me being the kind of people person that I am. Like, I'm naturally an empathetic person. I'm naturally a caring person. So me trying to just like reassure my patients, like, yeah, I'm here for you. I know I have all this stuff on, but please don't be intimidated. Like, I do not mind putting it on. Call me as many times as you need me. Like, I am here for you. It's me and you for these 12 hours. So whatever I can do to make you feel better and to make this experience slightly better, because it is a scary experience,
Yeah.
please let me know.
Wow.
So it's just a little difficult because we're in there so much. But our unit actually has these little headsets with microphones. So it's really nice because you're not like, oh, I forgot something and now I have to take all this out and take
Like
all this off and then go out and get it and then come back in. But now anybody that's on the headset can hear you. So I'm like, oh, hey, I'm in here. I forgot this. Can somebody bring this for me? So it's really good. My organization has really like made it, I feel like, as accommodating and as easy as possible to care for these patients compared to like probably other hospitals across the country.
So to follow up with that, the question I have for you is, what's been the most difficult experience that you've ever had as a nurse, and how does it compare to the pandemic that's happening right now?
So I would say before COVID, the most difficult experience, like the type of ICU that I work in, since it's a medical ICU, it's totally different from cardiovascular ICU or neuro ICU or burn or surgical. Like those ICUs are like different in their own world. But in MICU, we treat everything. So if somebody has like something underlying, some like a GI bleed, and they also have like hypertension and diabetes, they have all these extra comorbidities. They come to us because we work with what they call allergy, pulmonary, critical care medicine physicians, which are basically pulmonologists. Those are the type of attending physicians that staff our ICU. So before COVID, just a normal day in the NICU would be really difficult. I used to tell people, like, especially working across 3 different specialties in nursing,
Wow.
this is the hardest yet most fulfilling job that I have ever done because we work so hard. Like, I honestly feel like the nurses that I work alongside could run circles around any nurse across the country because the work that we do and the work that we're able to do is phenomenal. So normally, just a regular shift in the MICU could just be crazy, like from codes to emergency intubations, proning people, like it gets really wild. On to the contrary, this pandemic was not what we expected necessarily either. And like normally, like for instance, before, I've been there for 2 years, and before COVID, I'd seen maybe like 1 or 2 people be prone. We don't do much proning, which is just basically like normally when you lay in the bed, you're on your back. Proning is putting somebody face down. So when their lungs are really, really sick with what we call acute respiratory distress syndrome, or ARDS, some people call it, or ARDS, those patients, studies have shown, do a lot better and tend to improve a lot faster if they're prone. For some reason, it's the physiology behind it. I had rarely seen patients be prone because we're usually able to manage them with just the ventilator and different medications and like paralytic drips and things like that. But these patients are so sick to the point that we were proning people so much.
Wow.
So it was just like, and that takes 8 or 9, like you literally walk by the room and see 8 or 9 people in the room. There's like multiple physicians, multiple nurses, care partners, just anybody and everybody trying to literally turn the patient from their back onto their belly while they're still intubated, still have massive lines, like whether there's like on a continuous dialysis machine, like CRT, IV lines, like it is a whole process. So this virus has really, I feel like there's nothing else that can happen in my nursing career that will like compare to like what we're going through right now. It has been a wild ride.
Wow, that sounds mentally draining too. It's a lot. Yeah.
Very like exhilarating as well. At the same time, scary at the same time. Of all the emotions.
That's actually very interesting. To follow up with that, have any of your coworkers been diagnosed with the coronavirus themselves?
Nope. Thankfully, no. Haven't seen anything. Haven't heard anything. I have not. Like, the only thing is our occupational health is screening us every single day. And usually for like people that aren't on our unit, because we're considered a COVID unit, if they get exposed to a patient that's COVID positive, they have to enter this 14-day screening period where like every day you log like your temperature and if you're experiencing certain symptoms. Since we work on a COVID unit, we have to do it every single day for the duration of this pandemic, as long as it goes on. And thankfully, we have not
Wow, that's amazing.
had issues there.
So looking forward, What are some of your biggest concerns for nurses and healthcare professionals over the next couple of months?
Well, I wouldn't have had to say this if this was like 2 or 3 weeks ago, but it's been the last 2 or 3 weeks. We've
Uh-huh.
had some very wild suggestions come out.
Mm-hmm.
Um, More so the whole ingesting disinfectant and like Clorox and bleach and just Lysol. That's not what those things are made for. And the thing is, people know that. And I
Mm-hmm.
don't understand. I literally saw just, I think maybe not even a week ago, an article came out in the Tennessean saying like the Poison Control Center had seen an increase in calls
Mm-hmm.
for people that are ingesting disinfectants.
Yep.
That's not okay because then it's like those people that get really, really sick with that kind of stuff, that's a medical condition. They're going to come to our ICU. So we're still going to be battling the COVID virus, and we're also going to be battling people. Hopefully, people will not really continue to do this, but people coming in and utilizing ICU beds for ingesting Clorox, something that could have been prevented if somebody would just speak up and say, like, well, for one, you're not supposed to do that, and the label says you're not supposed to do that. It's not for internal consumption, and two, that's not how it works. So it's honestly there's no benefit and it's definitely just poisoning yourself. So I feel like over the next few months, if people continue to be like, oh well, our lovely president told me to drink a half a gallon of Clorox every day, so I'm going to continue to do it. That's going to keep the coronavirus away. That's going to be like an increase in ICU admissions because we're not supposed to be ingesting Clorox on top of the patients that still will have the coronavirus. Because honestly, even if the virus does die down, as far as like admissions to the hospital and ICUs, we're still going to be dealing with this and still treating patients with the COVID-19 virus all well into the fall. Like there's no doubt about it. So it's just going to make business even busier than usual.
So, if there's anything you would like to give as advice for people, what safety guidelines should individuals implement in their daily life? And what advice would you give them so that they could try to prevent themselves from catching COVID or giving it to a friend or a family relative?
Well, I think that kind of draws also into like one of the positives I see coming out of this pandemic in a sense, because it took a highly contagious virus turning into a pandemic for people to realize, hey, I should wash my hands. Hey, if I'm feeling sick, I probably should not go out. I should stay home. So like, it's just kind of like it sucks that it took this to
Mm-hmm.
happen for people to realize that. But in all honesty, I would just recommend that people continue to wash their hands, practice social distancing. There's really like no reason to be up under people unless they're your friends or your family. Not going places, even if it's work, school, home, the
Mm-hmm.
grocery store, if you're sick, especially if you're running a fever. Like if you have a temp, there is no reason for you to be around anybody because at that point you're more than likely contagious.
Mm-hmm.
So I would literally just recommend people to wash your hands as much as possible, stay away from people if you're sick. And even though a lot of states are starting to lift their stay at home orders,
Mm-hmm.
still be mindful that the virus is still out. And even if cases are going down, if we try to go back to how we were pre coronavirus, we're just going to see an increase in numbers. And it's just going to be the same thing over and over again. So wash your hands, stay home.
So, lastly, the American people need hope that this pandemic blows over. What final words would you tell them to ease some of their anxiety and fears?
Do you remember the bubonic plague? You remember, well, we don't technically because we weren't alive. The Spanish flu, the cholera outbreak. Like, it probably seemed like for those people back then that stuff was never going to end, but it does end. It just takes time. The difference with this one is it's more so like up to us knowing what we know to do our parts. And we all play a part in it in a sense because we can slow the spread and stop the spread of the virus compared to things like a cholera outbreak and having to drink water. So if we can just stay home as we can, only go out if it's a necessity, avoid people when you're sick, and continue to wash your hands and disinfect your surfaces. The nice new things that a lot of people have learned as a result of this pandemic, if we continue to do that stuff in everyday life, we will get through it. It's going to take time, but we will get through it.
Awesome, awesome. Well, Ashley, thank you so much for joining us and providing your insight and expertise to this conversation. Stay safe.
Thank you. You too.